Thank you for being here at the Icons in Surgery Session 2. My name is Bill Richards. We have two outstanding icons in surgery today to be honored. I'd like you all to remember that these sessions have been very, very special, but we rely on the comments about this session to obtain funding from the college to continue this. So we'd like you to pour out your honest comments about these sessions and about whether or not we should continue doing it in the future. So I'd like to have a lot of time for everyone to comment on these two outstanding icons. And I'd like to have our first champion, Sharon Stein, come up and introduce our first icon.
Thank you, Dr. Richards and Dr. Schwartzberg, and the ACS Video Committee for the incredible opportunity to be able to create this tribute to one of my true heroes, Dr. Patricia Numann. I want to thank the American College of Surgeons for creating the wonderful Icons of Surgery series so that we can recognize the people who have been giants in our specialty. Particularly this year at this conference, as we celebrate our new ACS president, the conversation is turned to role models and mentors. There is no doubt that Dr. Numann is an inspiring role model. But by deciding to make her an icon of surgery, the American College of Surgeons has not only ensured that she remains a role model for the men and women who have watched her career unfold, but for the generations of men and women to follow. And they will get to see the work, ingenuity, and quite honestly, the grit that got us to where we are today. Being asked to create this tribute for Dr. Numann is an incredible personal honor. Not only did I get to celebrate her with this video, but I have the unparalleled privilege of spending time with Dr. Numann. She is amazingly learned that there is no one as great as Dr. Numann to tell her own story. So without further ado, I'd like to present to you Dr. Patricia Numann, a surgical icon. Hello, my name is Sharon Stein. It's my honor to introduce to you Patricia Numann, an American College of Surgeons icon of surgery. Dr. Numann's contributions are not in a single field. Dr. Numann is a gifted educator. She's a skilled clinician. She's a tireless advocate and an amazing mentor to so many within the American College of Surgeons. It's the fact that Dr. Numann does contribute in so many different fields that truly make her an icon of surgery. Dr. Numann was born in 1941 in Bronx, New York. At age 4, during World War II, her father decided that New York City was too dangerous and moved the family to Denver, New York in the Catskill Mountains. Dr. Numann lived with her parents, her older brother and sister, and one of the great influences of her life, her auntie.
Auntie was always there. Auntie taught me how to do everything. Auntie was also very, very specific in what she expected of you. She taught me to read when I was probably 3 or 4 years old. I went to school knowing how to read. I remember that.
On her first day of school, she was told to go home because her school did not have a kindergarten. She was too young to start first grade. In the first negotiation of her life, she was allowed to stay in school as long as she could keep up with the work. Dr. Numann never looked back. Dr. Numann thrived in school. She went on to attend the University of Rochester, where she completed her undergraduate degree in 3 years and was accepted to the State University of New York, Upstate in Syracuse, a place that would become her home for her entire professional career. She was one of only 8 women in her medical school class. It was in medical school that she discovered her passion for endocrinology and surgery.
I was at the VA and I was assigned this man who had fainted He was a roofer and he'd fainted on the roof. I had him lie down so I could take his blood pressure. He says, "It's going to happen, it's going to happen." I said, "What's going to happen?" He says, "I'm going to faint." And sure enough, he faints. So I took his blood pressure, and his systolic blood pressure was off my blood pressure cuff, and his diastolic was like 160. When the resident took his blood pressure, it was normal. And I said, "Oh, he's got to have a pheochromocytoma." And of course, I was told what an idiot I was and how that wasn't possible. That was a rare problem. Lo and behold, he had a pheochromocytoma. The surgeon who took it out handed it to me and asked me if I wanted to touch it. And I said yes, but the next one I found I'd take out myself.
During medical school, Dr. Newmann's mother passed away from metastatic pancreatic cancer. Although she was excused entirely from her surgery rotation, Dr. Numann returned during the summer to spend time on the surgical service.
They were really the best doctors that I had seen. So that clinched it for me. I wanted to be a surgeon, and there was just nothing or anyone that was going to talk me out of that. I had not seen a woman surgeon, but it didn't strike me that there should be any reason that just because I was a woman, I couldn't be a surgeon.
But the road into surgery wasn't so easy. Most programs in surgery refused to even consider a female surgical resident. Eventually, she negotiated a one-year position at SUNY Upstate, and if she did well enough, she could remain as part of the pyramidal program. Again, Dr. Numann never looked back. Following residency, Dr. Numann remained on at SUNY Upstate, where she was the first woman surgeon to join the faculty. She built a general surgery practice with a special interest in endocrine surgery. Dr. Numann found that most patients accepted her as a woman surgeon, with the occasional exception.
One of them I remember so vividly. It was a man who had a colovesical fistula. His urologist had asked me to see him, and he looked at me, and took one look at me, he says, "I'm not having any woman take care of me." And I said, "Okay, I'm sorry, I didn't realize that you didn't want me to see you, but I'll call your doctor and let him know so he can find someone else to take care of you." And about 20 minutes later, I get a call from the floor, and the nurse says that this gentleman wants to see me again. So I go back, and he's sitting there very sheepishly in the bed, and he says, "Well," he says, "I guess I made a mistake." I said, "What's the matter?" He said, "Well," he said, "my urologist came in and he asked me what kind of a stupid so-and-so I was, that I didn't want the best doctor in the hospital just because she was a woman."
Although Dr. Newmann's passion was endocrine surgery, she always pursued opportunities to improve patient care and give back to the community.
I had decided that even though breast cancer was not my academic passion, it was going to be my public service work.
In 1986, SUNY Upstate created the Pat Numann Breast, Endocrine, and Plastic Surgery Center to help serve the patients that meant so much to Dr. Numann.
We would have some of the first dedicated nurse practitioners to work with us, and that would make sure that the women were given really the options that I thought that they should be given, and that we could accommodate the large number of women that we saw. So that really was the beginning of the breast center.
Not only did Dr. Numann serve the women of Syracuse, she helped change standards for breast mammography nationwide as a contributor to the Mammographic Quality Standards Act of 1992. Dr. Numann has had a distinguished career as a surgical educator, a founding member and former president of the Association of Surgical Education, a 30-year veteran of the American College of Surgeons CSAP Committee, and former chair of the American Board of Surgery. The American College of Surgeons asked her to lead the effort on the surgery resident skills curriculum.
We worked to develop this course that would teach them how to manage patients in a virtual reality. I call it cognitive simulation because I do think it is. It's training your mind to think in a logical way and manage patients in a logical way, to integrate data in a logical manner, et cetera. I think it's been a tremendous success, and actually my next retirement project is going to be to help get started the advanced curriculum.
There are so many adjectives that I could use just to describe her, but more than anything else, she is a true mentor, she is a true friend, And she probably is the person that we all aspire to be. I don't think we'll get there because I don't think there'll ever be another Patricia Numann. But thanks to her, there are thousands of women today who are able to pursue their dreams and become surgeons without sacrificing personal life. She has made a pathway for all of us to follow. We owe her such an incredible debt, and I'm proud to call her my friend.
Dr. Numann became interested in the role of women in surgery after attending a course for women in medicine early in her career.
It was eye-opening for me because I expected that many of these things happened to me because I was in surgery and there weren't any other women in surgery. But then I found out that these pediatricians and obstetricians and pathologists were treated as poorly as I was. I put up a sign to have breakfast at the American College of Surgeons. And actually about 20 women came. And the interesting thing to me was I liked them.
This was the start of the Association of Women Surgeons, an organization founded by Dr. Numann and her colleagues at the American College of Surgery meetings. Initially, the plan was simply to meet and create camaraderie.
There were maybe 10 women who would be really involved, but they put their heart into it. And it was funny when you think about it. Some of our strategic decisions were to make sure that the exhibitors at Clinical Congress knew we were surgeons, not just spouses or nurses.
But becoming more successful as women surgeons would require more than this. Katherine Anderson, first woman president of the American College of Surgeons, and Olga Jonassen were key in making sure that women in surgery were successful. Dr. Anderson.
Together, we formed a mini-group to locate and promote women surgeons for membership in the ASA and for the attention of the American College of Surgeons. Together with other women surgeons, we set out to look for worthy women, and the rest is history.
When you offer a woman a job or a position, you're far more likely to get the 52 reasons she can't do it than just, oh yeah, that'll be exciting and fun, I'll do that. Whereas when you do it for a man, it's almost like they were entitled to it. Like, what have you been waiting for?
She ascended through the ranks of the American College of Surgeons, ultimately culminating in being president, which was amazing and wonderful for all of us to see. And she was a leader in a strictly clinical sense at her own university. So a full professor, a center named after her, really a resource for students, for residents, for women in surgery everywhere who are able to pattern themselves after her in some small way.
Dr. Numann's sense of fairness meant that not only women needed to be promoted, but all underrepresented members of the American College of Surgeons. Improving opportunity meant finding collaborators.
My probably most beloved co-conspirator was Claude Organ. I just love Claude. We found out fairly early that it was almost easier for him to advocate for women and for me to advocate for blacks than it was vice versa. And we were able to do that and to have a role in having the first black president of the American College of Surgeons and the first woman president of the American College of Surgeons.
Dr. Numann has had a huge influence on the role of women in surgery. Her list of firsts is remarkable. She was the first woman surgeon to be on faculty at SUNY Upstate, the first woman president of the Association of Surgical Education, and the first woman chair of the American Board of Surgery.
I guess one of the hopes that I've had for the Association of Women Surgeons is that it actually almost becomes irrelevant. But then you go to the Academic Congress and the American Surgical Association and you hear about the wage disparities and the differences in opportunities sometimes for women, or the challenges that they still have to face in trying to balance their lives in general. I think there still is the need for advocacy for women. I think there still is the need for collegiality among women and for them to share the solutions to many of the issues that are fairly unique to women.
In 2011, Dr. Patricia Numann was elected president of the American College of Surgeons,
only the second woman to be elected to this prestigious office.
I actually went to my first American College of Surgery meeting in 1969 when I was a chief resident in surgery. And I have gone to every single one since. And my goal is to make 50 consecutive ACS meetings.
One of Dr. Numann's great interests as the president of the American College of Surgeons was to travel to international chapters.
When I became president of the American College of Surgeons and had this opportunity to travel to other countries, I would go to countries that I found interesting, that I thought that I could make a difference and meet people. And it was funny, actually twice, the people who invited us called to see if I'd made a mistake, and they thought it was someplace else because they had never had a president of the college come for their meeting. I was interested in healthcare. It became clear to me that women were going to be one of the solutions to the problems of poverty and to poor healthcare in these countries. If you don't take advantage of half of the population to make life better for people, you're never going to get there.
I met Dr. Numann when she came to Japan Surgical Society meeting as a ACS president. I realized, in addition to her prestigious status, she is kind of one of the ordinary, very friendly, wonderful people. During the meeting, she gave the very sophisticated lecture as the ACS president. So at that time, I was so impressed her accomplishment, and in addition to her work, I was so impressed by her character.
Dr. Numann's contributions reach internationally, but one of her greatest achievements was right at home at the State University of New York, Upstate.
Another thing that's been really very, very important to me has been the establishment of an endowed chair in my name at Upstate.
Dr. Patricia Numann is an institutional legend. She's famous as a leader of women's surgery, but what's more important, she is one of the great operating room endocrine surgeons. Her grand rounds on parathyroid surgery some 30 years ago was one of the all-time top 10 that I've ever heard. Her ability to tantalize and to stimulate students at every level is just outstanding. The future of surgery is going to lie with our women surgeons, and a lot of the model for that is going to be in what Dr. Numann has been, not only for surgery as a whole, but for the United States and especially for her home university. It's a privilege to be a part of this tribute to her. She's the most deserving person there could possibly be.
In 2007, Dr. Numann retired from clinical practice, but she has continued to play a role as an educator, mentor, and spokesperson for surgery.
For me, it's been just an incredible privilege to be a surgeon. And I could never have believed that I would have the privilege to do many of the things that I've done. And a lot of the things have been how you are able to relate to people, to get to know them, how they trust you, how they include you in their lives in a lot of ways that you could have never imagined. I can't imagine anybody ever not wanting to be a surgeon. I think it's just the most wonderful thing to be able to do. So I think that the future of surgery is as great as it was when I chose it as a career. And I encourage people to just go for it. You'll have a wonderful life.
Well, thank you. I know you all really came to see Dr. Schwartz's tribute, but thank you for coming anyway. I really appreciate it. It's just an amazing honor. Actually, when Sharon Stein called me on the phone, I said, "You have got to be kidding me." And she said, "No, really." And I said, then I thought about it for a while, and I said, well, why would you ever want me as an icon? So she said that she thought I'd touched a lot of people's lives and done things, and I thought, well, okay, you know, I'll do this. They'll figure out that I'm an imposter pretty soon, and I'll be done with that. But it really gave me a lot of pause for thought as to why I had done many of the things that I've done in my life. Number one, I think that my auntie was very important to me. She made me be very responsible. If you borrowed a penny, you paid it back. If you said you would do something, you did it, and you did it when you were supposed to. And whatever was going on, you knew about it. So it set some of the mottos for my life. Number one, I mind everybody's business. So I've learned a lot about a lot of things that I might not have known about if I hadn't had that curiosity instilled in me. And I think it's true in medicine, so that I've been able to be involved in a variety of things which have been really great. And the other thing that happened when I was a child was that my parents were always very supportive, but then I would go and do things like I went to school and they told me, no, you've got to go home because you're too young. Well, come on already. If I can do the work, why shouldn't I go to school? So I did. So no may be one of the most inspiring words in the English language. If you tell me no, I will for sure do it. So it gets me farther ahead, because a lot of people just go away when you tell them no. I was lucky. I came to the American College of Surgeons in '69, and it was just a mind-boggling experience. I had no idea how to deal with it, and I didn't see any women other than nurses and spouses, and so I wondered, but I kept coming back and was invited to join the CSAP committee in, gosh, the early 70s, and did it for years and years. But it got me to know the college and to have the college as sort of a friendly place to be. And that's why when I didn't see any women year after year, I actually wrote to the college. David Narwhal told me when he was writing the history book that it was the first time that women were even mentioned in the history of the college. And they did actually never speak to me about it, never did anything about it, but the women organized themselves, and so now we're here, and I'm very proud to say that almost all of the regents of the American College of Surgeons currently have been presidents of the Association of Women Surgeons. So I think it's been a good venue for women to find their leadership skills, to have an impact, to do things, and it was so wonderful that as a retiree, I could do things that I loved. So Dr. Sachdeva asked me to take on a project for the college, this fundamentals of the surgery curriculum, and I do believe it is cognitive simulation. I do believe that you can train people how to think better. So that's been fun. And then I've had the time to help really on the world scene by combining my love of travel with the opportunity to encourage women in other countries to become surgeons. So it's been great. As I said in the video, I cannot imagine that I could have ever had a better life, and I can't imagine that there could ever be a better life than being a surgeon. So thank you for this honor. Thank you, the committee, for this honor. And I could never thank anybody more than Sharon Stein for all the work that she did to put this together. So thank you.
Dr. Numann, please stay up there. You're a true inspiration to all of us, and we'd like other people who wish to make comments, step up to the microphones, introduce yourself, and make a comment. I can truly say that your life is truly inspirational about how we should treat the people around us.
Well, thank you. I think one of the things that makes a difference is that I'm nobody special. I come from Denver, New York, in Delaware County. None of you have ever heard of it. It's technically in the federally designated Appalachia zone, so I'm a hillbilly from New York. And I didn't have a privileged education or anything, but I think it tells you that it's not where you're from, it's who you are. And if you treat people well, they'll treat you well.
Thank you. Please introduce yourself and speak into the microphone.
My name is Mary Fallot, and I'm from Auburn, New York. And Dr. Numann holds a very special place in my heart. I went to Upstate Medical Center as a student. I claimed that I wanted to be a surgeon. She was my mentor. And actually, it is interesting that Dr. Poke was here and I sat next to him today because she sent me to Louisville, Kentucky to be a resident, and that's where I've made my career. And Dr. Poke interviewed her for a job some years ago, and she decided to stay in Syracuse. She said she sent me in her stead, and I'm a pediatric surgeon, and I've enjoyed my entire career there. And I know where Denver, New York is because in addition to being my mentor, Dr. Numann became my friend. She knew my family. She came to my house. She and took our family to her house where we spent many holidays and great times together. She has boundless generosity. I'm sure everyone in this room who knows her knows that. And it's not only to share her intellect and her spirit, but her friendship and her love. And thank you, Pat.
Welcome.
I've appreciated it.
Thank you. Mary is like my surgical daughter. I have no children, and so Mary is that. And she tells about Hiram Poke. The first thing that Hiram ever said to me is that he'd never known a woman surgeon he liked, and I told him I thought that was his problem. And and we've been lifelong friends. He offered me an absolutely phenomenal job, and I think that the best thing that I ever did was not take it because we've remained lifelong friends. He's he's really an enlightened man, and many of the people who have helped me have been enlightened men because when I started, there weren't women.
Sherry Wren from Stanford University. So I rise to celebrate this video commemorating you. And I can just say from having the pleasure of having traveled to some of those odd corners of the world with you, that when Pat Numann comes to a place, she uplifts everybody. And to see people and how they react to you and how you engage, encourage, and really inspire people, both men and women, has been great. And for me, most personally, she's also a whole lot of fun to travel with and be with.
And we're going on a safari
and
together.
we're going camping soon. So thank you so much. And Sharon, what a great video.
Thank you, Sherry. You know, it doesn't take any more time to help somebody than it does to ignore them. And I think that that's one of the things that I've always found useful is that, you know, if somebody asks me a question, I just don't say yes or no. I try to give them another suggestion. It also gets you out of doing the work, is to put them in line with someone else. But that's also been sort of one of the things in my life is that I like to help people, and I think that it certainly has rewarded me much more than them.
Barbara Bass. I'm the current president of the American College of Surgeons. Thank you, Patty. And I just want to thank you for making me one of your worthy women. You, Kathy, and Olga. I remember this I had these hands just kind of grab me and say, "You're there, go." And it was many things all at once. It was amazing, the many things all at once, from the American Board of Surgery to the things in the college to a variety of roles. But this was not a passive event. This was an active engagement. I really thank you for that. It was just amazing. But I also think it's really, I want to make sure all of us thank you for the humanity you've always delivered to this. But in particular, we women have to really be incredibly grateful for not just being a role model, but for just being a passionate person that has shared yourself so wholly with all of us. And I'm also just really looking forward, believe it or not, I'm also going on safari with Patty Numann. So I cannot wait. And Hillary's going to be with us. I can't wait to see the tour guide's eyes when the three of us walk in to go on safari together. I think it's going to be hilarious.
And if we get a hippopotamus attack, it'll wipe out American surgery to a certain extent.
At least it will be memorable, you know?
Yes,
That's
it will be
okay.
memorable. Well, you know, those days of sort of finding the worthy women with Olga were really amazing. Kathy named it the Hens Group, Have Equality Now, and I think it's a great title. And Olga called them the worthy women. But we also coupled that with what we called enlightened men, because if it weren't for the enlightened men who supported us, we wouldn't have gotten there. So it's been a journey of help from a lot of sources, and I think Barbara is going to be an absolutely spectacular president of the college.
Can we take a question from the back microphone?
Sure. I'm Debra Coulson. I'm from Las Vegas, Nevada, and I had the honor of being in Thailand at the same time as Dr. Numann. And I would just say, in addition to reinforcing everything that others have said, that she is well known throughout the world, and not just for recent events. When I was there, I met what I did not previously know was the first cardiothoracic surgeon in Thailand who Dr. Numann knew early in her career, and he really changed the life of particularly pediatric patients who were born with congenital malformations. I watched them just really honor that tradition and all of the people who were saved. She's very fun to travel with. I just happened to be there at the same time, and I took an aunt from a very small town in the Midwest. Her lifelong dream was to travel to Thailand, and she had no idea that we would also meet up with Dr. Numann, and we were literally treated like kings and queens, and Dr. Numann is so well respected, and I think just a great surgical leader for men and women nationally and internationally. So thank you so much.
Thanks. Could you imagine that two people from a surgical residency in Syracuse, New York, one would become president of the American College of Surgeons and the other president of the Royal College of Surgeons of Thailand? Now, what are the chances of that? Same year, whatever, and we've remained lifelong friends. As a matter of fact, we were so close when we were in Thailand. It was like old times again that Ken Maddox asked what was going on between the two of us.
Patty, this was absolutely marvelous. I've learned things about you that I didn't know before, and we've been friends for so long that I thought I knew everything about you, and obviously didn't. But I do want to tell you, everybody in the audience, one little anecdote, and I want you to tell me what the response was to that, or tell everybody. When Jonathan Meekins came to me and said, I'm really embarrassed about the dearth of women in the American surgical. And he also went to Olga, and Olga and I got together. And the first job, quite honestly, was to get Patty into the American Surgical Association. So I called her and I said, would you send me a list of people that I can get to support your application? She needed a sponsor. I was that. And so I got a list of well over 100 people from Patty, and I called every single one of them, and every single one of them wrote a letter of support. The American Surgical was absolutely deluged, and in fact, they made a rule after that you could only have 3 letters of application. And Patty, would you please tell the audience what the response was of one very prominent surgeon?
Well, it was sort of funny, because I really didn't think I would ever get in. It was just like getting into the SUS. Hiram supported me for that, and I never write and do things like that. And he says, well, you might just as well get nominated now because you're never going to be any different. And I did make it. But with that, actually, Cy Schwartz was one of my nominators, and Orlo Clark, and shows very generous people to me. But I got on the American Board of Surgery shortly after that, and at the board you have these little lunch tables, and so I was sitting at this lunch table, and John Cameron was sitting there, and I really didn't know John Cameron other than who he was, but I'd never said hello to him, and he certainly would have probably never said hello to me if we weren't across the table. So he looks at me, he says, I don't know who you are. And I told him who I was. And he said, well, yeah, he said, I was a secretary of the American Surgical Association, and we got hundreds of letters in support of you. He says, I don't know that many people, and I know they wouldn't write nice letters about me. So you never know.
Back microphone.
I'm Maxim Bulan, a past president of the Philippine College of Surgeons. We were together with Pat Numann when she was also president of the college. And I would like to especially mention and express our gratitude for the many mentorship that I had with Professor Numann. She has taught us a lot of things that we could apply to our college. And actually, one of the significant projects that we had is that we finally had the ATLS program in our country during the time of President Numann. And she was my travel buddy over visiting several colleges during that year. Thank you, Pat, for that lessons that I have learned from you.
Thank you.
Congratulations.
Well, and again, it's putting people together. When I found out that they wanted the ATLS course, I knew people in the college fairly well, so I called up John Files, and he says, "Did you know that I went to medical school in the Philippines?" I said, "No, I didn't have any idea." He says, "Of course we'll fix this." And so in no time flat, they were able to get the course and have it be successful. And now we actually have a visiting international scholar from the Philippines because of my friendship with the Filipino surgeons and the American Philippine surgeons, the Duremdes. So it's great. You can make things happen.
Can we have the back microphone first, and then the front microphone will be the last question?
Hello, my name is Sara Edwards. I'm a very junior trauma surgeon here at UCSD. I just wanted to share with you, I'm also Wendy Edwards' daughter. So when I started my training in surgery, my mother said to me repeatedly, "You really need to meet Pat Numann." And I have yet to formally meet her, but here we are. But I just wanted to share that because my mother is actually an internist who specialized in geriatrics and bioethics, and then is now a palliative care physician. And I think her praise of Dr. Numann really speaks to her comprehensive care of patients and a really big heart. And I think for us junior surgeons and women in surgery, that really speaks volumes, and I want to thank you.
Thank you. Actually, Wendy Edwards was my first doctor, or one of my first doctors. I don't go to the doctor very often, but I really liked your mother, and she tolerated my bad behavior, so it worked out well for both of us.
Hello, good afternoon. My name is Faida Badru. I am a PGY4 surgery resident at St. Louis University. You don't know me, Dr. Numann. I never met you before today. But I would like to take this opportunity to thank you on behalf of all of us trainees, especially the female trainees, for the work you've done in paving the way. It's people like you, Dr. Stein, Dr. Barbara Barlow, that we look at when things get hard or when we feel like we're in the minority, and that really helps us to continue to move on. We met you earlier today, myself and Francesca, and you actually stopped to compliment us, what she was wearing, what we were doing here, and it's just amazing because we've read about you, we've heard about you, we've tried to follow in your footsteps, and the fact that you actually took time to acknowledge us was just amazing. Thank you so much on behalf of all of us.
Thank you.
Really glorious.
Thank you. Thank you. Thank you. Thank you very much.
You're welcome.
Okay, thank you.